The goal of Men's Health Month is to heighten awareness regarding some of the preventable diseases and illnesses that we see on a day-to-day basis, especially in the primary care setting. And early detection is the key, and we want to just make some of those susceptible patients aware that early diagnosis is actually very important. The first thing is, one of the key points we see is the accessibility to health, because one of the issues that we see is some of the patients they go for so long without seeing doctors, and by the time they show up, some of the preventable illnesses have already reached what we call target organ. So we have to try to get these patients early enough into seeing their primary care doctors so that we can do early diagnostic testing and also try to guide and counsel them regarding preventing some of these chronic diseases. The number one cause of mortality in the US is, of course, heart disease. And that's where my focus usually is when I see the patient in the office. First thing, we normally have to screen for hypertension, and we look at some of these patients, some of the risk factors, and of course, some of the risk factors are modifiable and others are non-modifiable. Of course, age is one of them. As the older you get, some of those the patients, they become more sedentary in their lifestyle. So physical activity is one of the things that we kind of encourage for these patients. Second is, of course, diabetes, and the type 2 diabetes, which is almost like considered the adult onset diabetes, but with the increased incidence of obesity, we tend to see more and more of our patients, more of the incidents affecting the younger population. So the guidelines actually stipulate for trying to diagnose type 2 diabetes in any patient who has a blood pressure of 135 on 80. So, and it also goes with the BMI of these patients, 25 and above, that would fall within being overweight. BMI of 30 is obese. So some of these patients, we have to start diagnosing them earlier, even though the recommendation could go for an age a little bit higher. But we have to go case by case. There are the recommendations, and there are the actual figures and the actual patients that we see in front of us. So we have to bear in mind that we are having an increased incidence of diabetes, blood pressure issues, and the other one is we have to also screen a lot for smoking. That's one of the big things. I talked of heart disease being one of the chronic, the number one cause of mortality. The second is, of course, cancer in the US. So cancer, cutting across all the different types of cancer, but lung cancer is the number one cause. So smoking, of course, goes in line with that. So we always have to screen for smoking and try to counsel our patients regarding smoking cessation. Again, some of the things that we have to always screen for. Early detection also includes things like colorectal cancer. And some of these patients, by the time they present, they are already past 50, which is actually the recommended age to start screening some of these patients. For some reason, women are more proactive in, seeking medical care, but men tend to kind of wait, and I don't know, it's kind of tough it up, and by the time they present, a lot of times they already end organ damages, as I mentioned before. There are already complications. There are already things that they are not reversible. So if they can only show up sooner than later, then it would really make a big difference.